is Kelsey O'Neill and I am a fellow Minnesota nurse. In this short video, I am going to demonstrate the recommended workflow for filling out a POLST form with a new assisted living or skilled nursing facility resident. The POLST is endorsed by the Minnesota Medical Association, commonly known as MMA, and the Minnesota Geriatric Association of Inspired Clinicians, commonly known as MAGIC. It is also endorsed by the Emergency Medical Services Regulatory Board of Minnesota, the Minnesota Nursing Association, and the Minnesota Board of Medical Practice, so it is widely accepted throughout the state of Minnesota. This video is sponsored by the MMA and MAGIC. Before filling out Admission POLST with a patient, there are a few crucial steps. First, please determine if the patient already has a POLST or code status on file from the hospital or an outside facility. Please review this POLST before conversing with the patient and filling out a new form. Secondly, assess the patient's mental status based on their medical history and current nursing cognitive assessment. Does the patient have the ability to dialogue accurately about their medical history and respond appropriately to questions? If they have a known cognitive impairment, are they a capable decision maker? If not, identify who the appropriate surrogate is. Can you call the surrogate to be present for the POLST conversation? Third, the MMA strongly encourages the patient and/or their surrogate watch this 12-minute video on the MMA's website before filling out the POLST so they can better understand the medical decisions presented on the POLST form. Please offer this. This video will help clarify the information and answer many questions. Lastly, the POLST form requires multiple signatures. Please ensure you sign your name as the preparer, your title, phone number, and the date. If the patient or surrogate can sign, we strongly recommend you obtain their signature under Section C. Then the form can be given to the provider under Section D. Thank you so much for taking the time to watch this video and for all the valued work that you do. Mr. Nielsen, it's very important that we all understand what your preferences are regarding emergency treatment and other medical choices. We use a form called POLST to document these preferences. We have discussions with everyone entering our facility about the POLST form so we can best follow your wishes. After reviewing your medical information, I see you currently have the wishes of full code. I'd like for you to watch this short video that explains the medical choices in the form and to confirm your wishes. After you watch the video, I'll go over the choices with you. If you have any questions for the nurse practitioner or the physician about the choices in this form and what is right for you, that is absolutely fine. Here, I have the video loaded on my iPad. Let's take a watch.
Okay.
You have a right to make decisions about your medical care, and your preferences are important. The process of talking about your treatment preferences ahead of time is called advanced care planning. This process includes learning about your options and sharing your decisions with your family and healthcare provider. Once you've decided what you do and do not want, it's important to record your preferences. In your state, tools like the POST may be known by a different name, such as POLST, MOLST, MOST, or a variation on one of these names.
Mr. Nielsen, you don't have to make any choices today or ever for that matter, but it is our obligation to provide CPR and full treatment if we do not have any other documented wish. You can always change your mind about your decisions and we'll fill out a new POLST form. We also absolutely want you to ask any questions you have about your particular situation or health conditions with your healthcare provider.
Makes sense.
As you saw in the video, the first choice on the form is about cardiac arrest and CPR. That means your heart has stopped beating and you have died a natural death. About 1 time out of 20, or 5% of the time, we can reverse cardiac arrest with CPR. This would require emergency transfer to the hospital, use of a mechanical ventilator, and time in the intensive care unit. Unfortunately, receiving CPR can cause fractured ribs, and the lack of blood supply to the brain can cause brain damage. The 1 out of 20 patients that survives is able to leave the hospital and can usually care for themselves, but about half of them will have memory or mental health problems. Do you think you would want CPR attempted if your heart stopped, or would you prefer to select the option to allow a natural death and not attempt CPR?
I think I would choose the option of do not resuscitate, and I'd prefer natural death.
Okay, I'll mark that on your form here. The second section deals with medical treatments. There are 3 treatment options. The first is full treatment. This choice means that the patient would like all medical treatments used to prolong life. This would include treatments such as mechanical ventilation, kidney dialysis, intensive care, and major surgery. If the patient selects attempt resuscitation CPR in Section A, then they must select full treatment because these treatments are often necessary after CPR. Section B deals with medical treatments. The first option is full treatment, which includes intubation, which means putting a tube through your mouth and into your windpipe, and mechanical ventilation, which means using a machine to breathe for you. You can select DNR and still choose full treatment. Some people might choose this because although they don't want CPR attempted, they would still want full treatment for pneumonia or heart failure, where a ventilator treatment may be necessary in the intensive care unit. People that get this sick are critically ill, but they still have about a 50% chance of making a recovery. The second option is selective treatment. This means that if you had a serious problem, like pneumonia, you would likely go to the hospital and receive treatment such as intravenous fluids and antibiotics to cure the pneumonia. But you would prefer to avoid CPR or intensive care. The third option is comfort care. This option is for people that really want their treatment focused on comfort and prefer to avoid the hospital. They would prefer to be treated at home and don't want their life prolonged with medical treatment. People who choose comfort care and are terminally ill may qualify for hospice care.
I think I would probably like the second option, the selective option. If I was sick and I could go to the hospital and get some IV antibiotics and get better for a bad infection or pneumonia, I'd like that.
Okay. The next section has two parts. The first deals with artificially administered nutrition. This means food and liquids delivered by a tube into your stomach because you've lost the ability to swallow. This could happen from a stroke and be temporary, or this could happen from something more permanent, like dementia or Parkinson's. If you had a stroke, you may choose to have a trial of a feeding tube to see if after a period of days or weeks your swallowing ability returned. The form options are, number 1, long-term artificial nutrition by tube, number 2, defined trial period of artificial nutrition by tube, and number 3, no artificial nutrition by tube.
I guess if I had a stroke, I'd want a chance to recover from it, so I think I'd try that feeding tube for a few weeks.
Okay. The final part deals with treatment of infections with antibiotics. We would always recommend treating an infection for comfort. The video gives a good example, the treatment of a bladder infection with antibiotics. Antibiotics also can be used to prolong life, such as in the case of treating pneumonia. As an example, if someone had pneumonia and did not want antibiotics, we would use other treatments to keep them comfortable, such as oxygen and medication to relieve shortness of breath. If someone wants antibiotics, they may receive them by mouth or through an IV or shot called IM. IV antibiotics are usually given in the hospital, but can be given in some skilled nursing facilities. If you want to avoid going to the hospital, you may want to receive antibiotics only by mouth, meaning pills. The form options are, number 1, use IV IM antibiotic treatment, number 2, oral antibiotics only, no IV or IM, number 3, no antibiotics. Use other methods to relieve symptoms when possible.
Yeah, I would choose the antibiotic treatment, the intravenous kind or the injection if that's what was needed.
Okay. Mr. Nielsen, now here's where I sign the form that we went over everything together.
Okay.
Mr. Nielsen, do you have any other questions about the POLST form or the video?
No, I don't think so.
Okay. I noticed looking back that there are some differences between this new POLST form and your last one.
I think the video made it easier for me to understand, and you explained it more clearly to me this time than the last time I heard this, and I really think I understand my options now.
Good. I'm really happy to hear the form made better sense to you. I'll make sure I get the nurse practitioner or doctor's signature right away, so our orders reflect your wishes. They have reviewed the video and the options on the POLST that we discussed today, so they will understand your choices.
Okay. And on my end, I'll let my family and my kids know what we've done and that I have a pretty good handle on CPR and DNR and that we've discussed my medical care options.
Okay, great. Does the new POLST match the old POLST? If not, please call a provider as soon as possible for a new order for the desired code status. Write the new code status as an order after talking to the provider, then update the facility's EHR with the new code status. Then follow the facility's workflow to get a signature for the POLST form. Even if there is no change from the previous POLST code status, please deliver all completed POLST forms to the providers for final signatures. Thank you so much for taking the time to watch this video. I really hope this content was helpful for you. Take care.